The Western Pediatric Trauma Conference was held in July 2024, where new and important research was discussed. Follow along with us as we review the highlights.
Dr. Regan Williams, surgical champion of the Children's Surgery Verification Program at LeBonheur Children's Hospital, reviews best practices on guideline implementation.
Guideline implementation is really important. It really is the connection between research and improving the clinical care that we give every day to our patients.
And what are the steps we should take when creating institutional guidelines?
So the first thing you want to do is figure out what it is that you want to make a guideline on. What are the potential benefits for your patient? So what are we trying to change here? What are the cost savings for the hospital? And the next thing you want to think about is who is important to talk to before we implement the guideline. Really making sure that you have all the stakeholders at the table in the beginning.
You definitely want this to be multidisciplinary, and that means across different specialties, but also across different disciplines.
You want to think about enablers, but then also think about barriers. How do we get this guideline implemented, and how do we get buy-in, including the one person that you know is never going to want to do it?
You want to make it local. Think about your current practice and try to standardize that practice with your institution in mind. And keep it simple.
Always get your baseline data so that when you get your outcomes data, you know how to compare and to measure. Measure adherence and outcomes so that we can show if it works. We can make the changes as necessary, and we can tell the story about why this is important.
Remember, we're always trying to improve outcomes for our patients. It's a learning process. If we aren't changing things, then we are probably moving backwards.
Join us at the next conference to hear more great insights into pediatric trauma.